does that sound? Okay. What is your mother's maiden name? Good job. And how about your childhood pet? Yeah. Okay, correct. Nice. Alright, well, everything seems fine in your file. I see that we do have a cranial nerve examination today. Does that sound good for you? Yeah. That's what you came in for, cool. My name is Dr. Munch, and I am here to go ahead and provide you with the most sophisticated and the most professional and the most in-depth cranial nerve exam for you and for your health. We want you to come out of this session today with a brighter mind, more knowledge about your body and you as a human being. How does that sound? Good? Good. Well, you just stay right there while I go ahead and do some general checks on you. I'm going to go ahead and get your heart rate and your breathing. So, okay. Yeah. Okay, stay exactly where you are. Just go ahead and breathe in and out for me when I say so. Your heart rate seems perfectly fine. Yep. A little bit higher because you are in a clinical setting, so that does make sense, but so far so good. Just go ahead and breathe in and out. Good job. And one more time in and out. Good. And the last time in and out. Good. Okay. Everything seems perfectly fine in terms of your heart rate and your breathing. Your lungs seem like they are perfectly normal here. Okay, we do first have the olfactory test for the cranial nerve exam. Now, this olfactory test basically involves me giving you 3 different items to smell, and you just go ahead and tell me what it is that you smell through your nose, or what you feel like you smell. Yeah? Okay, well, let's go ahead and continue. Okay, so what does this smell like to you right now? I'll give you a second and let you take another sniff. Menthol, very good job. Very, very good job. That is spot on. It is menthol. Okay, the second one that we have here. What does it smell like to you? Roses, correct. You're doing very good. Very, very, very good. And how about this? Coca-Cola. Correct, that's 3 out of 3. Good job with the very first test. Okay, next we do have the Optic test. Now I'll be testing your visual acuity, your visual fields, and also your light response. Now, to begin with this test, I'm going to go ahead and show you some colours, and I want you to go ahead and tell me which colour you see. Okay. Which colour is this? Yellow, correct. And this? Red, good job. Correct. Good. And last one. Good job, that's 6 out of 6 you got there. Very nice work on that little part of the test. Now, I also have another little thing for you to do for me. I want you to just go ahead and gaze, just follow it. Continue following it. Yep. Good job. No matter where it goes, just follow. Good. Very good job indeed. Okay, good. Nice, you can go ahead and relax. Okay, for the last part, for this optic test, I just want you to stay very still and stay exactly how you are, and as a visual cue, just go ahead and take a look at this button right here, the button of light, the green light. Just keep your eyes fixated on that button right there. Okay, I'll go to that side. Continue looking at where you think the pattern would be, even if my head is in the way. It's cool. Good. Good. Relax. Very good job once again on that test. Very good job. Okay, you ready to move on? Yeah. We can move on indeed. Next we do have the ocular motor, trigeminal and abducens eye test. It's basically the eye movement. So just stay exactly where you are and I'll go ahead and get this ready for you. Okay, first, just follow my instructions. Go ahead and look up. Just with your eyes, not with your head. Look up. Go, look down. And now here. Okay, now, just follow this light right here with your eyes. Continue to follow it no matter where it goes. Okay, cool. Now just stay where you are while I do a tiny logic in your eye. On both eyes. Good job. Okay. Now we next have the Trigeminal test. That's for your face and your jaw movement. Now, I will have a sharp or dull test to do, and before I go ahead and do the sharp or dull test, I'm just going to go ahead and check your face and your movements and see if everything is correct. Okay, cool. First off, just go ahead and clench your jaw for me. Clench, clench, clench. Good. Okay. Stay where you are. How does this feel? You can feel the brushing that I'm doing on your face right with my fingers. Good. Okay. Now we have the sharp or dull test. For this test, I'm going to go ahead and need you to close your eyes for me. Thank you very much. Now, I will touch various different places on your face, either with something that's sharp or with something that's dull. I will be using the end of my little comb here for the sharp one, and then the flat surface for dull. Okay? Good job, close your eyes. What did you feel? Sharp or dull? Sharp. Good job. How about that? Sharp or dull? Sharp. Correct. Okay. And now, sharp. Okay. How about now? Dull. Good. discrepancy in this side of your face. Yeah, kind of like over here, but that's okay. I'll write that under my nose. It's nothing to worry about at the moment. I will write that down in my notes and we can have a follow-up appointment about your nerves or your nervous system right about in this area. We'll dive further and kind of see what we have there in a later session. Yeah, cool. You did a very sweet job on there, indeed. Now, which test do we have next? We have the facial test. Now that's expressions and taste. So with this, I'm not going to go ahead and do your taste. However, I will need you to make some expressions for me. Okay. First off, just go ahead and smile for me. Hey, wow, very beautiful smile. And now, frown for me. That's a mean looking frown. Okay, raise your eyebrows. Good, and relax. Puff out your cheeks for me. Good job, and relax. And now just tap your teeth. Yep. Okay, good job. Very good job. That's that test done. Everything's fine there so far. Next we do have a hearing and balance test. Now, with this one, I am going to go ahead and need you to close your eyes again, and I'm going to make various little sounds or whispers or little things in each ear of yours, and I need you to tell me in which ear you hear it. Okay? Good. Eyes closed. Good job. Which ear did you hear that? Nice. Which ear did you hear that? Good. How about that? Good. Nice. Good job. Good. Very good. You can go ahead and open your eyes and relax for me. Good job there. Okay. I'm gonna also now do the same thing again, but this time it'll be with a tuning fork. With this, you can kind of, it's basically harder than hearing individual sounds in the ears, as this is a certain frequency, 128 C to be exact. But yeah, close your eyes please. Thank you. Where do you hear this? Good. And now? Good. 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 Job. Okay, that's brilliant. That's actually spot on once again. Very good work you're doing here now. Yeah, you can open your eyes. You can go ahead and relax. Okay. We next have a taste and swallowing test. Okay, just give me a second to look in my booklet. Now I'm not going to go ahead and do taste once again because I feel like we went over that in your previous test anyway, but for now what I will need you to do is just open your mouth for me, swallow for me please. Good job, and just say ah. Yep. Good job. That's a very simple one. Not really much going on there in that one. Next we do have a neck and shoulder test. It is the accessory test. Okay, now in this test I'm gonna go ahead and need you to just, yep, look in this direction. Good. And now the opposite. Good job. And now look up. Nice. And down. Cool. Now just do that one more time, all around. Go. And right. Good. And up. Nice. And down. Thank you very much. We're almost done. We don't have much left now. We have one more test, and that is the hypoglossal test. This is basically a test for your tongue movement. It's a very simple one. There's not really a lot to it, but I'm gonna go ahead and need you to just stick out your tongue for me. Yeah, good. And now just wiggle it about. Good symmetry. Nice. Yep, okay. Now wiggle it to the left and stretch it out to the right. Good. And try and stretch as far as you can on the top. Okay, and now bring it really flat down. Cool. Now stick it out as far as possible. Okay, good. Very good. Well, that is the cranial nerve exam done for today. I have your records here. I'm going to go ahead and update them from the notes that I made in this cranial nerve, but other than this little nerve issue you might have in your face, which we will go ahead and examine next time you're in the clinic. But now everything is